Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University, and we have a very interesting show today. We're going to talk about holistic and healing dentistry, and you're going to find out about that from Dr. Yanni Dixon, who is a biological dentist. Dr. Dixon, how are you?
Very good. Thank you for having me here.
Thank you.
Very excited to share some information.
Thank you. And Megan Mers, who is a registered dental hygienist, and Megan has the opportunity to see a lot of people like yourselves that are watching, and she's going to tell you why you need to have a dental hygienist see you. Correct, Megan?
Yes, correct.
Right. Okay. So, Dr. Dixon, tell us about what is a biological dentist?
Well, biological dentistry focuses primarily on offering the same comfort, aesthetics, and function to patients under a more toxin-free environment and materials. We want to minimize exposure to toxins, to galvanic corrosion and stress, and also select materials that will have less immune reactivity on our patient's immune system.
My understanding is that you became very interested because of immunosuppressive disease issues. Mm-hmm. And I'm not asking you whether it had to do with you, that's not my question. But you got interested in that, and you started to, I guess, devote your time to do exactly what you just said, mm-hmm. and that is change the elements of presenting dental medicine as we know it today in an environment which is less toxic. Is that what you're saying?
Correct.
Right.
I mean, there's a large percentage of the population that are very sensitive to multiple chemicals, and that accounts for about 33%. So based on that, and based on the studies from the International Academy of Oral Medicine, which was created in 1984, supporting a more biological, biocompatible practice of dentistry, raised the interest on me on further my educations in a more biological aspect of my practice. We see a lot of people with autoimmune conditions, chronic inflammatory diseases, and they come to the office highly educated, looking to get heavy metals out of their mouth, find materials that are less toxic, less plastic, less BPAs, and that are linked with activation of the inflammatory cascade and lymphocyte production that would trigger autoimmune condition. So it's been a blessing having these patients, because it's also a learning, a symbiotic relationship that we have with them. They are so educated, they know what they want, and I think that every time we become more capable of providing a more biological, less toxic environment for them, and also for us as an occupational hazard. We've been exposed to so many chemicals, just environmentally, so we try to make in the office a healthy environment where we inhale less mercury pollution or vapors that are being linked with degeneration of the central nervous system, that can cause desensitizations of a lot of our immune cells, especially lymphocytes, T cells, and also provide with alternatives that will cause less side effects and risk to our patients' overall health.
So, Megan Mers, how do you fit into this picture?
So being the hygienist, it's really great in this office because we're very chill in our office, and Dr. Yanni lets me explore, lets me do whatever I want to do, and we just, our goal is to really help each patient individually. We want them all to be healthy, obviously, but so many of our patients, they come in with, periodontal disease and all sorts of problems with their mouth. But for me, it's so important to get them their gums especially back to health. So for every patient, you know, we measure their gums. We want to see their starting point, and from there we kind of put together a treatment plan or a game plan, and we get to treat each person how they need to be treated, you know, whether that be a deeper cleaning or a prophylaxis, which is, it's really great because, you know, those people that come in and they need a lot more work, or, you know, the deeper cleanings, when you're finished with everything and you bring them back in and their gums have healed, it's an amazing feeling.
Let me ask you, because, you know, the typical viewer who's watching right now says, well, I go to see my dentist when I'm in pain, or I have a real problem, and that's when I go to the dentist. Now, that's not the way to take care of oral health, but let's be real about it, that's what a lot of people do.
Oh, for sure.
But there are the people who do see their dentist twice a year, as generally prescribed in good health habits, and they get to see their dental hygienist at least twice a year.
Yes.
Hopefully either at the same visit or sometimes attendant to that visit, correct?
Yes.
So tell me again, because you talked about prophylaxis and things of that nature, but people understand that they know now that a dental hygienist just doesn't clean your teeth.
Right.
So make it oversimplistic and tell them what you do in a prophylaxis, and tell them what you're doing. You're doing certain elements of scaling and treatment that is associated with the care that Dr. Yanni gives. So explain it.
Yeah, so if a patient's coming in for a prophylaxis, we start every appointment by measuring their gums like I talked about earlier. That way we can make sure that their gums are staying stable. If they're not staying stable, then, you know, there's something we got to do to change that. So as long as they're healthy and stable, we'll continue on with the appointment. You know, we explore to make sure there's no tartar, calculus buildup underneath their gums, and then we go on with the scaling and what needs to be done. What I love about our office is we make our own cleaning paste instead of, you know, the little individual ones that you've seen probably at most of your dental offices. We make it from scratch with all natural ingredients, baking soda, coconut oil, essential oils, and all things that are, you know, chemical free, which is really great, and it tastes good too, so that's a plus. And, you know, for patients that come in and they need the scaling and root planings, where you go under the gums and you remove any bacteria, toxins, or tartar buildup that's under the gums. Once we're done with all of that cleaning, we use a chemical-free irrigation product. It's a mouth rinse, but it's all made of essential oils as well. And we use ozone therapy to help bring oxygen into it, and that helps disinfect any like leftover infectious microorganisms or stuff like that. And that we kind of squeeze in between the pockets and stuff. So that really helps clean everything out at the end. And we are really leaning towards using laser therapy instead of antibiotics for people with those pockets in their mouth, the deeper pockets when they need the scaling and root planing, just because we are walking away from, you know, any antibiotics. We don't want to put anything foreign in the body unless it's absolutely necessary. But with the laser treatment, it's a diode laser, so it's not harsh to your body. There's no chemicals going in, and we've seen really great results with that helping heal your pockets and stuff.
Well, Dr. Yanni, I guess you have, Dr. Dixon, I should say, I call
I
you
go
Dr.
by
Yanni,
Yanni.
but you certainly have someone working with you that is, I guess, not only knowledgeable, but enthused by the partnership that she has with you. But in your practice, do I assume that you, as a general dentist, that you do all the other procedures, or what?
Yes, we do the wide range of different.
Okay, periodontist, endodontist.
Well, in the office we have a periodontist.
You have a.
Yeah,
Tell me the setup of your office. Go ahead.
Well, I'm the general dentist who does all the restorative work, cosmetic work. I do some simple extractions as well with guided tissue regeneration and prepare sites for implants, but more advanced surgeries. In biological dentistry, we also focus on the detection of cavitations through 3D scanning taking a CT scan to determine bone lesions or bone necrotic lesions that could be a source of chronic inflammatory conditions to the body. After extractions, if the tissue is not very well cured, a lot of people can walk away healing, but leaving leftovers of granulation tissue, inflammatory tissue that can lead to release of inflammatory proteins into the bloodstream that can have an impact on your cardiovascular system, can have an impact and predispose you to cardiovascular events like heart attacks, strokes. So we emphasize in a thorough medical history review, determine the root cause of a lot of problems. Like we talk about periodontal gum disease, trying to find the cause, what's the medical or the systemic condition aggravating and giving us all the oral manifestations. Because unfortunately, 80% of all oral conditions will have a systemic impact in our body. Will impact also our microbiome, the change of our microflora and the type of bacteria that lives in our intestinal gut will reflect the changes also in our oral environment, because the intestinal tract starts in the mouth, and a lot of people don't make the connection of the mouth with the whole system. They take it as a separate entity, not knowing that 80% of systemic medical illness or diseases are produced in the mouth. In the mouth is when we start seeing a lot of the culprit of disease, where it starts the oxidative stress impacting this healing and how cells regenerate. So we try to do a very thorough nutritional counseling as well. We test the pH of our patient's saliva, because cells need to heal under alkaline conditions. We try to make patients aware about the processed food, fast food, and the impact that it has, the nutritional impact it has in their body, and the healing as well, and the production of a lot of inflammatory proteins that could impact the healing rate. And we're not going to say that everybody heals 100%, so we have to look at the root cause of their problems. And through a medical history review, the medications they take, the possible allergies that they have. We try to work with cardiologists, with a lot of physicians too, because I think the biological dentistry, even when it's not an actual specialty, it's a mindset, an attitude, incorporating a less toxic environment, but a more systemic and interdisciplinary approach to try to find the root cause of our patients' conditions.
We did a large clinical study, research study here, on the question of cardiac disease, and I guess you could say periodontal disease. It was a little bit more than just periodontal, but in essence it was periodontal disease and the effect it had on the cardium.
That's one of my passions. My dad had 2 strokes, so that triggered in me to, find that connection. My dad struggled for periodontal disease his entire life, so multiple periodontitis. And when I saw him, being affected by such debilitating condition, having a stroke, triggering me to associate with the International Academy of Oral Medicine, because besides your immune system, bacteria, the acidogenic theory, we needed to look into something else. And the first thing that I did is inspecting my dad's mouth. He lived in South America, so I wasn't taking care of his dental condition. And I noticed he had a lot of mercury fillings. Mercury's fillings, and there's studies about they're being linked, inhibited a very important enzyme, COMT, catecholamine transferase, which is involved in the kidneys regulating high blood pressure. So that was for me a very interesting finding. I mean, basically because it's related with something that is so close to my heart. And another thing is knowing that what we're exposed on a regular basis, I mean, we are taught to believe that amalgam, silver fillings are alloys that are mixed, and once are in the mouth are inert. But really, science is proving otherwise, and that's becoming an occupational hazard and also an environmental pollution. I mean, just to say it, an average dentist releases about 250 micrograms of mercury into the sewage. And I know that's why the EPA now is implementing new filtration system for mercury for the water, because they know that's contaminating our soils, our water. So an average dentist produces about 12 tons of mercury. That has a major negative impact in the environment. I mean, there's so many aspects about contamination and toxins that interest me from a personal point of view. And I mean, I suffer from a lot of endocrine disruption and thyroid issues. And we notice that a lot of chemicals that we deal on a regular basis in dentistry are hormonal disruptors, can cause infertility, can cause delayed hypersensitivity, not only the immediate allergic reaction, but also the delayed reaction. That's why when we're dealing with patients that are very debilitated or sick, we recommend Clifford test, which is a test that can test for hypersensitivity to all the different materials that we use in the dental practice, so we can select the materials that are safer and patients can tolerate without an exacerbated hypersensitivity reaction.
What do you think about all of the implant issues?
Well, there's new data showing that implants will never give you an immediate rash reaction, which is the typical allergic reaction that we tend to see with nickel, for example. And nickel, it's involved with a lot of prosthetics, and we deal with nickel. It's in our stainless steel material sometimes. But titanium, what we see, some patients, fortunately it's only 4% of the population that are more prone to develop allergies to titanium, can develop a delayed hypersensitivity reaction, which is a type 4. You can use a test, it's called the Melissa test. If you're suspecting you might be allergic to titanium, you can test for that. The Melissa test is a memory lymphocyte activator test, and it shows if your lymphocyte have a reaction or had developed antibodies that will make a positive finding for allergy to titanium. But now we have also zirconia implants that are becoming more broadly used in the dental field, and especially in the biological field.
The truth is, though, that you know, the general dental community is using products that are presented to them through their educational process. Mm-hmm. Many of the people have been out of their educational process for 20, 30 years, and they're doing the same type of dental practice that they did 20 and 30 years ago. So